All right, friends, we're here at PFRANKMD, and if you're wondering why I have such a handsome gentleman in the chair and why he may just look a little bit like me, it's because he's my uncle. And my uncle has had a long history of growing up in Florida and had a lot of non-melanoma skin cancers. So we are here to do Fraxel today. And this is one of the common treatment protocols for Fraxel that people forget about, that when you remove sun damage, you are actually decreasing your risk of non-melanoma skin cancer. Why? Because it's directly related to sun damage. He has had things removed before. He has a lot of scrapey, crusty material, which are what are called AKs, or actinic keratosis. And most importantly, he has brown spots. And he's a Frank. He's way too good looking to have all these spots on his face. And at PFRANKMD, we're going to get rid of all of it. One treatment is going to make a huge difference, but patients with a history of basal cell or squamous cell carcinoma, usually I do a small series and I recommend 1 or 2 a year, and this is really dependent on how severe it is. Scalps, chests, ears, these are all very common areas. He's sitting with anesthesia for an hour, and this can be used with, again, close follow-up by a general dermatologist to make sure that there's nothing that needs removal. This will not treat skin cancer, but it will prophylactically prevent it, and it will treat actinic keratosis, otherwise pre-cancer. So we're going to get started. A lot of men seem to carry their sun damage in the scalp and or receding hairline. It's an area where they sweat away the sunscreen, where they tend to get sunburn. The good news is Fraxel does not destroy hair, so it's very safe to go over hair-bearing areas. Okay, Ron?
Yeah, perfect. You got a very good touch there, Paul.
Yeah, it's called anesthesia.
Yeah.
Because usually the scalp is very sensitive, so the longer you sit, the better. Once they go on the cheeks, it usually gets a little easier. One of the common treatments in dermatology for pre-cancerous lesions is something called photodynamic therapy. A topical chemotherapeutic agent is put on the face that is photosensitive. So by shining what's called the blue light on you, it kind of hyperactivates the actinic keratosis and helps treat it. The good news is that works. It's often covered by insurance, but it doesn't treat any of the cosmetic aspects of sun damage. Fraxel will treat both the medical and the cosmetic aspects of sun damage, which is why it's not something covered by insurance. Photodynamic therapy, like Fraxel, does similar things and can be done in combination.